we're going to talk about some common diseases that your book goes over. I'm probably going to break this down into a couple of different videos because this is a lot of information and I want to make it as simple as possible because you could get really in-depth with some of these diseases, but we're just skimming the surface right now so you have a basic understanding of what they are. So for the integumentary system, the only one we're really going to go through is shingles. This is a pretty common viral infection that is caused by the varicella zoster virus. This is the same virus that causes chickenpox. So what happens when you get chickenpox at any point in time, that virus never really leaves your system. It lies dormant in your nerve cells, and it can become active again during a time of a lot of stress, and it can develop into a shingles rash. So this rash follows a nerve pathway. Sometimes it wraps around your abdomen, but it can really be anywhere. It's extremely painful, and it can cause permanent nerve damage. So this is something that we really like to avoid. That's why we try to push vaccinations, that varicella vaccinations, because if you've never gotten chickenpox, you're never going to get shingles. So the shingles can spread throughout the body. It can even become internal. I've seen shingles down the throat. And like I said, it's extremely painful. So somebody that has an active shingles infection is infectious to other people as well. So if you are taking care of somebody that has shingles and you come into contact with the liquid that's inside of the blisters on the shingles rash, then you could develop chickenpox from that. So it is highly infectious. So really, truly, the best course of action is prevention. We want to prevent the person from ever getting chickenpox. If they do have a shingles infection, the treatment would be antivirals and just pain management and good skin care because, like I said, this person's going to have open sores that are very painful. So the musculoskeletal system, there's arthritis. Arthritis is joint inflammation. Osteoarthritis is the most common form that you see. It's usually related to aging, and this is often confused with osteoporosis. So make sure that you know the difference between osteoarthritis and osteoporosis. Those are not the same thing. Osteoarthritis has to do with joint inflammation. Rheumatoid arthritis is an autoimmune disease, so that's when the body attacks itself, and that causes joint inflammation. It can even cause some deformities, like you see, there's a picture here, an x-ray of some deformed joints because of all of that chronic inflammation. And then gout is a buildup of uric acid inside of a joint that's also very painful and causes a lot of inflammation. So osteoporosis can happen with aging. This more common in females, usually Caucasian females. If they are small, that puts them at high risk for osteoporosis and not getting enough calcium early in life. This is when the bones become more porous. It's almost like they have large holes in them, and it makes them brittle. It puts the person at risk for fractures. A lot of times, elderly people, when they get fractures, it wasn't necessarily from a fall. It might be from a fracture that caused a fall, not a fall that caused a fracture. It's just the bones become so weak and so porous that they're not able to hold the weight of the body anymore, and they just fracture. And then fracture means broken bone. I probably should have said that to start with. So fracture is a broken bone, any broken bone. There are several different types. So if somebody comes in and we suspect a broken bone, we're going to do an x-ray to find out exactly where this fracture is and exactly what type of fracture it is. The only one that I'll mention is open. An open fracture means that the bone has penetrated through the skin. So a closed fracture, it has not penetrated through the skin. So then we'll get into the respiratory system. So the two major respiratory illnesses that we want to talk about are chronic COPD and asthma. Okay, so COPD stands for chronic obstructive pulmonary disease. And it's a combination of two different things. It's chronic bronchitis. So some of you may have had acute bronchitis related to allergies or just respiratory infection. But this is a chronic thing where the person keeps getting bronchitis over and over and over again. And emphysema, which is damage to alveoli. So somebody could have one or the other or both. The number one risk factor for COPD is smoking. So if you've never smoked, the odds that you'll get COPD are much lower. So chronic bronchitis causes a lot of secretions, coughing up a lot of phlegm, makes it difficult to breathe.